Hi, my name is Sheikh Asif. I've been living in Dubai for almost 28 years. I was diagnosed of bladder tumor cancer in 2017, say June, July. Some of the final stages where I was really struggling and I started to see a lot of symptoms. I found there was a doctor in Mediclinic, Dr. Gazamfar Chowdhury, and we started the treatment with him. We managed, after a few surgeries within the span of 8 to 10 months, to eradicate the tumor from my bladder. Last year, when I had my full body health check, I found out that my tumor was back. When I met Dr. Mudhar for the first time, it was an amazing experience where he came up with a lot of ideas, but the most important was that he heard my story and he heard my pain, and he knew that I was reluctant on getting away any organs from my body. So we started talking and he did all the checks and he removed the tumor from the bladder. At the same time, what he suggested was to do a full body check to see if the tumor has spread across the other parts of the body, and everything was fine except a surprise in the kidney. Finally, he said that the only option is to remove the kidney, as my other kidney was not working, to go on a dialysis. As it's a big decision, I remember very well doctor saying that this is a big decision of your life. Come back to me when you're fully ready. I found out my insurance has a second opinion program. So one of the doctors looked into my case and he came back saying that because I have used some of the medication similarly in the past, and this might work for me. I came running to Dr. Mudhar. I said that, is this gonna help? He said, yes, it can. And we didn't have the medicine here, so we have to work through a way. We had a very good relationship, I would say, in terms of a doctor and patient. All of this is a big credibility to the staff of the Mediclinic as well as the doctor. He was very positive about everything. I came back to him and it gave me a lot of confidence in him. My problem, when it was my problem, it was only my problem till I came to Dr. Mudhar. After that, my problem became their problem. And that's how we actually went through this. So it was us who's fighting with everything. So thank you very much, Dr. Mudhar and the staff and Mediclinic. I want to thank my company for providing such an amazing insurance which covered the entire treatment, and also my ex-boss who actually gave me the idea of going for the second opinion program.
Actually, I met Asif last year as a part of his first consultation. Asif has suffered from bladder cancer, which is a cancer of the inner line of the urinary bladder. And it is the same inner line in the ureter and the renal pelvis, where he unfortunately developed another tumor there, which is actually quite rare. It's 5–10% of the cases that develop tumor in the upper tract, and these tumors in the past, we used to remove the whole kidney and the ureter as a golden standard treatment. But with evolvement of science and evidence, we now selectively can treat some cases with so-called kidney sparing surgery, that we don't need to remove the kidney. We can laser ablate the tumor and sometimes add some local treatments. One of the local treatments that has been used is the mitomycin. Mitomycin is a local chemotherapy that can use to ablate tumor cells. But the problem with using this kind of medication in the kidney, that you need the medication to stay. This is where we came to a discussion, because Asif's case is a unique case because he has a single kidney, and the option to remove the kidney means that he ends with dialysis. After discussions, after he get a second opinion, there is a drug newly introduced in the world. It's a thermal gel. It's the mitomycin as a gel. And this mitomycin can be slow releasing in the kidney in 4 to 6 hours. And this is what we agreed, that we do a combined treatment with both laser ablation of his tumor and putting the gel in the kidney, trying to cure the disease. We built a very nice friendship that we discuss frankly what is our expectations, because in all these cases, decision making together is very important for the patients, because at the end, our expectations will determine our success rates.